How do doctors perform a basal cell carcinoma biopsy? When a doctor suspects basal cell carcinoma, they need to confirm the diagnosis with a biopsy. This involves taking a small sample of the suspicious skin tissue for examination. The procedure is usually done in a clinic or doctor's office and is quick and safe. To keep the patient comfortable, local anesthesia is used to numb the area before the tissue is removed. This means there is little to no pain during the process. There are 3 common types of biopsies used for basal cell carcinoma. The first is the shave biopsy. In this method, the doctor uses a small, sharp blade to carefully shave off the top layers of skin, including the lesion. This technique is often used for superficial basal cell carcinomas that are on the surface of the skin. It does not usually require stitches because only the outer skin is removed. The shaved tissue is then sent to a lab where a pathologist looks at it under a microscope to check for cancer cells. The second method is the punch biopsy. Here, the doctor uses a circular, hollow tool that looks like a tiny cookie cutter. The punch tool removes a small, cylindrical piece of skin that includes all layers from the surface down to the fat underneath. This full-thickness sample helps the doctor understand how deep the cancer has grown. After removal, the wound may be closed with stitches, especially if a larger piece is taken. The third type is the excisional biopsy. In some cases, the doctor may remove the entire lesion along with some surrounding healthy tissue. This is often done if the lesion is small and easy to remove. The goal is to both diagnose and treat the cancer at the same time. The entire lesion is cut out, and stitches are used to close the wound. The process begins with cleaning the skin area thoroughly. Then, the doctor injects local anesthesia to numb the site. Once the area is numb, they carefully remove the tissue sample using one of the methods described. Afterward, the site is bandaged, and the patient receives instructions on how to care for the wound. The tissue sample is sent to a lab where a pathologist examines it under a microscope. This helps confirm if the lesion is basal cell carcinoma and determines its specific type and depth. Once the diagnosis is clear, the doctor discusses treatment options based on the biopsy results. For basal cell carcinoma, treatments can include surgical removal, most surgery which is very precise, or other methods like cryotherapy or topical medications, depending on the size, location, and aggressiveness of the tumor. The biopsy is a crucial step because it helps ensure the cancer is fully removed while preserving as much healthy skin as possible. Patients should always follow their healthcare provider's instructions and attend follow-up visits to monitor healing and catch any signs of recurrence early.